We have several posters in this meeting, but I would like to start with talking about the poster which is called Validation of Our Model, but I need to explain. Usually, myelodysplastic syndromes is diagnosed, or the syndromes are diagnosed by bone marrow biopsy and examination. Still today, in 2023, in order to diagnose MDS, we need to do a bone marrow examination. Now, what's the problem? There are several problems associated with bone marrow examination. Number one, it's an invasive procedure. Many patients do not like it. It's painful. It's not terrible, but it's painful. Patients do not like it. Some physicians would try to avoid it. Number two, sometimes it is associated with bleeding, especially in patients who already have low platelet count and tendency to bleed. So it might be associated with bleeding. Rarely, but it happens, it may be associated with infections. And last but not least, the interpretation is done by pathologists or hematologists or hematopathologist, and it is clear that it is somewhat subjective with what we call inter-observer differences, which may get to 15 to 20%. In other words, I may say something and someone else may say something a little bit different. Not completely different, but some of it somewhat different. So probably it has come time in 2023 that we might use more modern, less invasive techniques, and maybe we can try, at least in some patients, if not in all patients, to avoid this bone marrow procedure, which has been with us for more than 100 years, maybe more. So we in our center developed a tool, an artificial intelligence tool. This was a joint project of the team in our center with the European MDS group. What we did, and we presented it in previous ASH, but I will repeat it very shortly. What we did basically, we took data of 500 patients with MDS, and we compared to 500 control subjects, people who had bone marrow also, but MDS was excluded. And we compared numerous variables between the MDS groups and the control group, and we came up with a very simple model consisting of 10 simple variables which every physician in the community has it, such as age, sex, hemoglobin, MCV, white blood cell count, monocyte count, serum creatinine, serum glucose, just 10 simple variables. If you put these 10 simple variables in the web app that we developed, you get a score and you get a picture and you get a line which falls in one of three colors. If it's in the one color or the green color, it means very likely MDS. If it is in the red color, it means very likely not to be MDS, and if it's in the small area of the brown color, it is still questionable. We showed that by this you can distinguish 86% of the suspected people, leaving only 14% of the people with question. And this system can allow you to diagnose, but even better, to exclude the possibility of MDS, and at least in some patients, the bone marrow examination can be avoided. Now, this was the previous work. This meeting, we are presenting validation data. Every new model has to be validated in order to be distributed and well accepted by the community. And what we did here, we took data on patients who did not serve for the development of the model. So these are completely new patients, and we took about 100 patients with MDS, and again compared their data to 100 controls who also had bone marrow, but MDS was excluded. And we came to the conclusion that the model works fairly well. The sensitivity is not too high, but the specificity is very high. In other words, to make it more simple, it is good, not perfect, to diagnose. It is very accurate to exclude. So if a physician suspects that that a particular patient might have MDS, he can use this model, and if according to the model, the likelihood of MDS is low, probably in these patients, bone marrow can be avoided. I can just tell you that another group, the German group from Düsseldorf, also did a similar study and came to similar conclusions and validated our model. So this is one of the modern tools that are now in our hands. This is why I like it, because it might change a paradigm of diagnostic procedures. So this is one work that we are presenting here, and I'm sure that this is part of the new era, that using AI tools and new tools, modern tools, in the diagnosis as well as prognosis of patients with MDS and other diseases.